There has been a marked increase of the influenza virus, but epidemiologist Dr. Avery Hinds believes it may not be a fair comparison since testing was more focused on COVID-19 last year. Speaking at the Ministry of Health's COVID-19 update, he said influenza seems to be one of the more dominant non-COVID diagnoses coming through the laboratory, with the H3N2 influenza strain mostly in circulation.
The number of cases so far for this point in the year, or up to this point in the year, actually does exceed the number of cases that would have been detected last year. But we do have to bear in mind that the testing was more focused on COVID-19 last year, to some extent at the expense of other testing, because the resources for testing all of these viruses are shared.
Dr. Hinds also provided an explanation as to why influenza cases are still popping up even outside of the typical season.
We would have had a lot of movement within the July-August period. We would have had a reintroduction of travel, bringing things from other countries into our population in a pattern that would differ from other years. Because there was a reduction in mobility followed by a removal of those restrictions and spikes in travel at points in time that don't correspond to the normal travel periods,